Had earlier indicated that some arrests had been made. You also heard him clearly condemn these attacks on health workers and then also urging the public to desist from doing that. But beyond these assurances and the arrests that have been made, the Ghana Registered Nurse and Midwives Association say there's a lot more that needs to be done to protect their members. And this was in a statement they released not too long ago this evening. And this is portions of it. They say, one, that they're making demands that the Ghana Police Service must intensify their efforts in getting Ralph St. Williams and his accomplices arrested as soon as practically possible. So even though the health minister says there's been some arrest made as a result of that, we don't know the identities of these persons who have been arrested as a result of that incident at the Ridge Hospital. Ghana Registered Nurses and Midwives say if Ralph St. Williams and his accomplices are not part of the persons who have been arrested, they want him and the others arrested too. That this will serve as a deterrent and assure nurses and other health workers at the Greater Accra Regional Hospital, that's the Ridge Hospital, of their security and mitigate the impact of the trauma in terms of their mental health. Also, say we hold dear our nurses and midwives and respect the mandate they have entrusted us with. We therefore take this opportunity to assure every nurse and midwife out there that the leadership of the Ghana Registered Nurses and Midwives Association will continue to serve your interest and protect you with all we have within the confines of the Constitution of Ghana, the Labour Act of 2003, Act 651, and the GRNMA Constitution. They say that our inpatient and outpatient department patients are important to us, and as their advocates, we will continue to campaign for a more resilient health system that guarantees quality and safe services. They assure the patients at Ridge Hospital of the continuous provision of nursing and midwifery services, and that Ghana Registered Nurses and Midwives will not allow them to suffer unduly for the total disregard of law and order by Ralph St. Williams and his associates. They also say they're calling on their employers, that's the government, to strengthen security at all health facilities and assure them of partnership to improve the health system of Ghana, and treating the management of Ridge Hospital to provide psychological support for the nurse who sustained injuries from the attack and enhance general training of staff on coping mechanisms in managing the stress of their daily work schedules. Austin Gamey is a labor consultant. He's joining us on the telephone. So Gamey, thank you. You've seen this matter evolve up until this point where earlier today the health minister did talk about measures put in place, arrests that have been made, but there's a lot more that the Ghana Registered Nurses and Midwives want put in place. It's a good demand going forward, you would say?
So much. I think that this particular matter has brought about the need for the employer in particular and generally the whole country to take notice of the fact that we are reasonably well educated, we can read and write, but it's about time some new or some approach or some kind of reorientation is given to both the workers and the general public as to how we relate. Number one, it is important for the workers, the health workers in the various hospitals to take notice that the patients that come to them are equally very, very important to they themselves, because they are the main customers that they have. All the patients are the main customers that they have. The patients also serve an important, part in the relationship as well. They serve as raw materials also for the learning of hospital, those who work as hospital workers, including doctors, including all other paramedics and so forth and so on. It's very, very important that they take notice of that. Whereas we, the people who go to the hospital to seek support from the health workers, including doctors, nurses, lab people, and so forth and so on. We must also see them as very important people who are there to serve us and protect our interests as well. So the two sides are very important. None is more important than the other.
Right.
But without the patients going to them, they don't have anybody as customers they can relate to. And sickness will never stop. It will always be there. And we will always go to the hospital. We also need them. So both parties are very, very important. So a new orientation is required to enable all of us to appreciate the importance and the important role each one plays.
Mm-hmm.
None is more important than the other.
Right. And I do appreciate you for this. Thank you so much for joining us with your very, very important thoughts on this matter. Gamey is a labor expert. This is Ghana Tonight.